This is from Edinburgh Evening News, published on MSN.com, distributed from them. COVID, increased risk of death and serious health problems from repeat infections, provides fresh incentive to get booster vaccines. At the Lies of the Devil YouTube channel, under the playlist Live Coronavirus Pandemic Updates, you'll see that the Australian health experts in the government recommends against getting a 5th COVID vaccine dose. This conclusion was gleaned from health data collected by researchers at Washington University from almost 500,000 U.S. veterans. It found that if a person caught COVID after having had it before, they were more likely to have issues with their lungs, heart, brain, blood, muscles, and digestive system than if they had never had the infection before. Researchers found that lung problems were 3.5 times more likely, heart problems were 3 times more likely, and brain issues 1.5 times more likely in people who had multiple infections from the virus. They also found that people who had repeated infections were 3 times more likely to be hospitalized and twice as likely to die than those who only had COVID once. This is the opinion part of this person right here. If some people still need to be persuaded to participate in the NHS winter vaccination program for flu and COVID, then surely studies such as this must provide food for thought. There is another study he brings about, the Lancet report, saying that COVID-19 vaccination has substantially altered the course of the pandemic. Okay, there's that study. And I also have one right here about the Lancet. Caution required when using HIV medication, Retinavir and Paxlovid, Pfizer molecule, and COVID-19 management, and how it causes, well, you go rewatch that video. So there's this article. I'll leave the articles below that you can go read.